Namaskar दोस्तों, good evening friends. I am Dr. Sanjay Kalra, your friendly and familiar endocrinologist, and you're watching Dr. KK's Med Talks, Mondays with Dr. Sanjay Kalra. आज के हमारे नॉन-स्टॉप शो का 798 798वां एपिसोड है. Let's have the headlines for today. कोविड का प्रकोप बढ़ता जा रहा है पूरी दुनिया में, चाइना में, कोरिया में, बाकी देशों में. But in the meanwhile, Alembic Pharma has received the US FDA nod for its injection called Fulvestrant. Government has taken cognizance of the COVID threat, and as we take guard against COVID, experts have ruled out a BF.7 wave in India for the time being. मगर अगर वैक्सीनेशन की बात की जाए तो भारत बायोटेक is still to begin incubation, and what they tell us is that BF.7 boosters are still in the laboratory stage. अभी ये पेशेंट्स के लिए क्लिनिकल यूज के लिए तैयार नहीं हुई हैं ये वैक्सीन्स. कोविड के अलावा और भी बीमारियां हैं, एंड टाइप 2 डायबिटीज इज समथिंग दैट ट्रबल्स अस अ लॉट. रिसर्चर्स हैव रिपोर्टेड दैट सेल थेरेपी may reduce kidney damage from type 2 diabetes. And the World Health Organization has released new family planning and abortion care competency standards for health workers. इंडिया में हाल ही में हमारे MTP मेडिकल टर्मिनेशन ऑफ प्रेगनेंसी के लॉज भी बदले हैं, रूल्स बदले हैं. तो इफ यू नीड हेल्प, जस्ट स्पीक विद योर क्लोजेस्ट गायनेकोलॉजिस्ट और इवन विद योर आशा वर्कर, दे विल गाइड यू. इस न्यूज के साथ लेट्स गो टू आवर टॉपिक फॉर टुडे. अब आज का हमारा टॉपिक है लिविंग विद हाइपोथायरॉयडिज्म. तो अगर टॉपिक है लिविंग विद हाइपोथायरॉयडिज्म, तो एक्सपर्ट कौन होंगे इसमें? डॉक्टर जो थायराइड का इलाज करते हैं, या वो लोग, वो व्यक्ति, वो मनुष्य, वो इंसान, वो महिलाएं, वो पुरुष जो थायराइड के साथ जीते हैं? Obviously, the answer will be second. Someone who has lived with hypothyroidism is the expert. मगर अकेले अपने साथ जीना या बाकियों को भी एक हेल्दी जीवन दिलाना, एक्सपर्ट की खासियत क्या है? तो आज की जो हमारे एक्सपर्ट हैं, वो अकेले अपना ही ख्याल नहीं रखते, वो पूरी दुनिया का ख्याल रखते हैं. अ वार्म वेलकम टू अशोक बसीन जी. वार्म वेलकम सर. हाइपोथायराइड की स्पीड थोड़ी थोड़ी कभी कभी स्लो होती है, तो हमारा टॉपिक भी हाइपोथायराइड है, एंड इट इज कोल्ड आल्सो इन नॉर्थ इंडिया, एंड इट इज वेरी वेरी कोल्ड इन कनाडा. वसीम साहब, वार्म वेलकम सर.
थैंक यू.
वसीम साहब, ऑफ कोर्स नाम से आपको सबको पता चल गया होगा, हमारे ही छोरे हैं, हमारे ही लड़के हैं, एंड ही लिव्स इन कनाडा एंड ही इज प्रेसिडेंट ऑफ थायराइड फेडरेशन इंटरनेशनल. Ashok Basin ji has 2 master's degree under his belt. He has worked in pharmaceutical industry in India and abroad, and now he looks after an international federation of persons living with thyroid. He works with doctors in the thyroid space, that is endocrinologists, and इनका उद्देश्य क्या है, उनका एम क्या है, वो जानते हैं सर से. Warm welcome, sir.
Thank you very much.
Sir, lots of people have logged in. Dr. Sanjeev Puri हैं from Dasua in Punjab. स्वप्ना जैन मैडम है, लीडिंग पेशेंट हेल्थ एडवोकेट फ्रॉम वेल्लोर इन तमिलनाडु. डॉक्टर रमेशपाल सिंह पवार सर इज अ पीडियाट्रिशियन, ही इज 73 इयर्स यंग. सत्येंद्र जी, डॉक्टर गौरी शंकर धर्मराज लॉग्स इन फ्रॉम कर्नाटका वेयर ही इज अ डॉक्टर. एंड डॉक्टर RS चौधरी, वन ऑफ आवर सीनियर मोस्ट फिजिशियन सर्जन्स फ्रॉम हरियाणा. डॉक्टर विपिन भडूला इज अ पीडियाट्रिशियन फ्रॉम हिमाचल प्रदेश. सो एंटायर इंडिया वाचिंग. एंड वी हैव अ क्वेश्चन फ्रॉम अथर्व सिंह. सर जी, आपका क्वेश्चन हमने एक्नॉलेज कर लिया, but let's ask Mr. Ashok about himself first. Sir, अपने बारे में तो बताएं. What brought you into the thyroid space?
I was in the pharmaceutical industry where I was managing a thyroid product. And once I left the company, the foundation which I was helping, which was Thyroid Foundation of Canada, they wanted me to join their board. I did. And after a year, they chose me as the president. And after 3 years, I joined the international, which is present, the Thyroid Federation International. And I became the president 10, 11 years ago. So we have around 35 countries that we are managing right now under that.
So Thyroid Federation International. So let's go through this one by one. International तो सर हमें समझ आ गया, it is more than one country, right? फेडरेशन मीन्स अ ग्रुप ऑफ ऑर्गेनाइजेशंस. तो ऐसा नहीं है कि, ऐसा होता है क्या सर उसमें कि जो प्रेसिडेंट हैं उनकी मर्जी चलती है, नॉर्थ कोरिया स्टाइल आप बिल्कुल चुपचाप उनका कहना मानते हैं, या व्हाट डज द फेडरेशन मीन?
नहीं, फेडरेशन ऐसे अपनी नहीं चलती है. उसमें तो बोर्ड ऑफ डायरेक्टर्स भी रहते हैं, और एजीएम जब होता है तो सब कंट्रीज़ के मेंबर, उनको एक वोटिंग राइट रहता है। तो वो लोग डिसाइड करते हैं किसको बोर्ड में चुनना है, किसको नहीं चुनना है, और क्या ऑब्जेक्टिव्स हैं और क्या बायलॉज हैं। तो हम लोग के सब बायलॉज, ऑब्जेक्टिव, रूल्स, रेगुलेशन, सब कुछ है। तो उससे काम चलता है, हमारी कोई ऐसी पर्सनल अथॉरिटी नहीं है।
सर ऐसा ही हमारी बॉडी में होता है। जो हमारा एंडोक्राइन ग्लैंड्स हैं, सो इन द बॉडी हाउ डज द बॉडी कम्युनिकेट विद ईच अदर? इतने सारे ऑर्गन्स हैं, इतने सारे अंग हैं और इतनी सारी कोशिकाएं हैं, मिलियंस एंड बिलियंस ऑफ सेल्स। तो आपस में ये बातचीत करते रहते हैं। ये जो बातचीत है, दिस इज डन ईदर थ्रू द एंडोक्राइन सिस्टम, दैट इज थ्रू हार्मोन्स, और थ्रू द नर्वस सिस्टम, नसों के जरिए, नर्व्स के जरिए। एंड ये भी एक फेडरेशन है सर। तो जिस तरह से ऐसे थायराइड ग्लैंड नहीं कह सकता कि मैं अपनी मर्जी ही चलाऊंगी। तो या जो किसी का हार्ट है या किसी का दिल है या किसी का ब्रेन है, वो अपनी मर्जी नहीं चला सकते। सब आपस में बातचीत करके, सलाह मशवरा करके, दे ट्राई टू सॉर्ट ऑफ कंटिन्यू लाइफ इन अ हेल्दी मैनर। जिस तरह से मान लो 4 घोड़े हैं और एक रथ चला रहे हैं, तो आपस में ये इकट्ठे मिलके उस रथ को चलाते हैं। मोस्ट ऑफ द टाइम दे डू अ गुड जॉब, वी आर हेल्दी। तो सर ये जो इंटरनेशनल हो गया, फेडरेशन हो गया, एंड दिस इज जस्ट लाइक आवर बॉडी। तो थायराइड क्या होता है सर, एंड व्हाट मेड यू इंटरेस्टेड इन दिस फील्ड?
और थायराइड, तो ये नेक के लेवल में बटरफ्लाई शेप ग्लैंड होती है, छोटी सी ग्लैंड है, लेकिन ये छोटी सी ग्लैंड बहुत बड़ा रोल प्ले करती है, you know, and blood streams के थ्रू, ब्लड के थ्रू, T4 जो होता है वो, that is spread all over the body. Now whether it is your heart, or your, how fast your heart can beat, or how slow, it controls that too. Metabolism, it controls your metabolism in the body too. At the development of the brain, if you don't have T4 cells going in the brain, then your brain won't function. And that is why it's very important that when the children are born, हर बच्चे का T4 टेस्ट करना चाहिए, क्योंकि बच्चे को, सबको जॉन्डिस तो होता ही है, आई में काफ़ी बच्चों को होता है जब पैदा होते हैं, लेकिन ये सिम्टम भी है कि जॉन्डिस है। और दूसरा सिम्टम होता है कि प्रोट्रूडिंग tongue, in those children. They look sluggish, they sleep a lot, and if we don't correct that immediately, तो इसका तो ब्रेन नहीं डेवलप हो पाएगा। तो बहुत से कुछ केसेस में ऐसा होता है, छोटा नंबर है लेकिन फिर भी उस केसेस में ऐसा होता है कि बच्चे बिना थायराइड के पैदा होते हैं, which is congenital thyroid. So I don't know, I've gone away on the topic, but
दैट्स वेरी इंपॉर्टेंट सर। बाकी लोग भी आपको ग्रीट कर रहे हैं। अली नजाकत साहब सलाम कर रहे हैं आपको। पंकज
salam.
शुक्ला जी सवाल पूछते हैं थायराइड की डोज का। पूनम बजाज मैडम हैं, शी इज अ नर्सिंग प्रैक्टिशनर इन न्यू दिल्ली। शी इज ग्रीटिंग यू, एंड डॉक्टर गौरी शंकर एंड अंशु सिंह जी, दे टॉक अबाउट डिफरेंट एस्पेक्ट्स ऑफ थायराइड मेडिसिन। वील डू दैट। गणेश शंभोरे जी भी आपको ग्रीट कर रहे हैं सर।
Thank you.
तो ये तो आपने बता दिया कि थायराइड छोटा सा ग्लैंड है, जस्ट अबाउट 25 ग्राम्स,
Yes.
मतलब 25 ग्राम का है ग्लैंड, बट इट पैक्स अ पावरफुल पंच। खूब
Oh
जोर
yes.
से मुक्का मारता है। अगर ज्यादा थायराइड काम करे तो भी जोर से मुक्का मारेगा, अलग बीमारियां आएंगी। अगर कम काम करे तो भी दिक्कत आती है। तो
Exactly.
डॉक्टर धर्मराज आस्क्स, सर व्हाट आर द कॉमन सिम्टम्स दैट वी हैव? यू
Well,
टॉक्ड
one of
अबाउट
the,
चिल्ड्रन, या
yeah.
अडल्ट्स एंड एल्डरली सेपरेटली अगर आप कर दें तो।
या तो पहले तो बच्चों के बारे में बता देते, क्योंकि हम लोग बच्चों के टॉपिक पे थे। तो उसमें तो जॉन्डिस, व्हेन द चाइल्ड इज बॉर्न, तो जॉन्डिस होता है उनको। और दूसरा होता है वो स्लीपिंग, दे स्लीप मोर देन नॉर्मल एनी अदर चाइल्ड। स्वॉलन प्रोट्रूडिंग टंग, large soft spot on the head, on the forefront, and large swollen tongue, weak floppy muscles, swelling around the eyes, poor or slow growth. So these are some of the symptoms for the children. Now, when you come to the adult, in adults, mostly, 50 की एज एवरेज ले लो, उसमें ये केसेस रहते हैं, लेकिन ये किसी भी एज में हो सकता है। तो टायर्डनेस एक बहुत बड़ी चीज़ है, तो बहुत ही थकान महसूस होती है, और ऐसा महसूस होता है कि हम अपने ये जो बेड के ऊपर नेल्ड हो गए, मतलब उठने का मन ही नहीं करता है। और दूसरा है सेंसिटिव टू कोल्ड, होर्स वॉइस भी हो जाती है कई केसेस में, ड्राई स्किन, वेट गेन, then coarse hairs and skin, numbness and tingling in your hands. So these are some of the symptoms that happened with hypothyroid condition. But tiredness, feeling tired all the time, is very important. और जब लोग ये कंप्लेन करते हैं कि हम बहुत ज़्यादा टायर्ड फील कर रहे हैं, उस सिम्टम पर ध्यान देना चाहिए, क्योंकि कई लोग इग्नोर कर देते हैं, अरे तुम एज का फैक्टर है या ऐसा है। तो ऐसा नहीं समझना चाहिए, तुरंत जाके जांच करानी चाहिए ताकि पता चले कि क्या क्या है वजह।
So tiredness, yeah, easy fatigability. This is a common symptom of hypothyroid. There is a model that we follow in health, and it is called the biopsychosocial model of health. And Poonam Bajaj madam जो हैं, जो nursing teacher हैं, she knows this very well. When you talk about health, you don't think only about biomedical aspects. You also think about psychological and social
करेक्ट,
aspects.
करेक्ट।
And we welcome Helen Devi ji. And we are actually translating in both English and Hindi, so you won't miss anything out. Even if we shift into Hindi or Punjabi, rest assured that the translation will be given in English as well.
हाँ, हम तो 5-6 भाषा बोल सकते हैं इंडिया की, तो उसमें कोई दिक्कत
Yes.
की बात नहीं है।
And we also have Dr. Pradeep Rawal from Ujjain in Madhya Pradesh. One of our senior most viewers, Kedar Joshi Sahab, has joined, and also Pratipati Ram Babu ji. But so coming back to the biopsychosocial model of health, when you see what Ashok Sahab has taught us, tiredness, the tiredness can be physical. I am not able to walk as fast as I want to. I get breathless if I walk too fast. It can be psychological also. I just don't feel up to it. मजा नहीं आ रहा. तो शारीरिक कमजोरी या शारीरिक थकावट और मानसिक थकावट. I am not able to think as fast as I want to. I become forgetful. And
Yeah.
samajik, social. Yeah, yes, sir.
Another thing is you cannot focus on anything, for a long time. You cannot focus on your work. You cannot focus on what you're reading. You can't remember things. Those kind of things also happen. So, to your point, absolutely, those are also symptoms apart from physical symptoms.
Yeah. So physical, psychological, that is lack of concentration, and also social. The smile. Somebody comes to meet you at home. Your best friend comes. You find it an effort even to smile. It might be thyroid actually. And then
Correct.
your best friend comes and says, "Gumsum kyun ho? Why are you so silent? I've come to meet you from Canada after 3 years, and the least you can do is give me a hug and smile, and you're not even able to do that. That means you go and get your thyroid done."
Absolutely. Yeah.
Yeah. Before rushing for medicines for depression or anxiety, a thyroid test would be indicated.
Yes, you hit it on the nail, because many people feel that this is a depression, and people are depressed, and that's why they're complaining all these. So very often it is diagnosed as depression. So that should be ruled out. TSH test is important. Without
Yeah.
doing the TSH test, you won't be able to pinpoint. That's why you have to do the TSH test.
And so many doctors we have in the audience today, and people from the public, especially for the elderly people. If you see a sudden change in mood, sudden change in behavior in someone at home, someone who is a senior citizen, do think of thyroid, and do think of low sodium as well. Maybe some medicines are going on which are causing thyroid. Maybe some medicines are causing a low sodium. So please do rule these out. They're very simple tests to do, and you can improve the quality of life of your senior citizens, your loved ones. Sir, one question coming from Atharv Singh ji. We have lots of medical questions coming up. So
Yeah.
please feel free to take or bounce back. Atharv Singh ji is living with hypothyroid for the past 25 years. Now Atharv is 39, which is a wonderful age to be. Wasim sahab, kya kya haal hai?
Oh, it's wonderful age to be. I wish I was 39, but I'm fine.
Abhi Atharv, when you are 40 na, then Wasim sahab and I will teach you all the secrets of big boys. अभी छोटे हो तो but he has a problem, and the problem is we assume that the thyroid is normal, but still he has a lot of pain in his body. So anything from personal experience, what should he do?
Well, what happens is one of the things that he might be wanting to find out is, first of all, if his TSH is close to around 1, okay, after the medications. One thing. Second thing, I'm not sure whether he's taking the medication at the right time, okay, because if you don't take the medication first thing in the morning without any food, anything, there should be at least 1.5, 2 hours gap from taking the medication, levothyroxine, to the food, because it can bind to minerals and to other stuff, so protein and minerals. So it's very important you take it on an empty stomach, and then the bioavailability will be better. and he will get the right, or she will get the right dosage. So that is very important, because this is one thing which is overlooked and people don't take it at the right time. Even at the pharmacy level, they don't tell you that you should take this on the empty stomach, and take it, uh, 2 hours before you take anything else. So that is one thing. Second thing, even if the person is taking at the right time and doing everything correct, in some 5 to 6% of cases, sometimes they have issue with some excipients in the tablet. What I mean by excipient, मतलब जो दूसरी और चीज़ें टैबलेट का बल्क बनाने के लिए डाली जाती हैं, तो उनसे भी, जब मैग्नीशियम स्टीरेट हो गया, या कुछ कलर जो डालते हैं टैबलेट में डिफ्रेंशिएट करने के लिए, उन चीज़ों का भी इफ़ेक्ट कभी-कभी हो जाता है। तो ये भी ज़रूरी है कि देखना चाहिए कि क्या है रीज़न, और फिर डोसेज टाइट्रेट करने से यू नो अप्रोप्रिएट लेवल मिलेगा। तो ये ज़रूरी है, ये सब देखना भी।
So make sure, Atharv that you are taking the medicine at the right time. TSH भी देख लें, मिडिल में होना चाहिए रेंज के। अगर TSH बहुत कम है, उससे भी दर्दें होती हैं। और चीजें भी देख लें, मे बी अनीमिया, खून की कमी, मे बी विटामिन बी या विटामिन डी या कैल्शियम की कमी. So ABCD, very common in India, and all nutritional. A for anemia, V for B complex deficiency, C for calcium deficiency, and D for vitamin D deficiency. E is for exercise, and actually it's about physical conditioning. तो कई बार हम एक्सरसाइज करते ही नहीं है, हम हिलते ही नहीं है, एंड देन आवर बॉडी जस्ट गोज आउट ऑफ ट्यून. तो देखो, हर चीज की सर्विस करनी पड़ती है ना, गाड़ी की भी. यू हैव टू सर्विस योर कार. सिमिलरली यू हैव टू सर्विस योर बॉडी एज वेल. And actually, Vasim Sahab, in the Bhagavad Gita, Arjun asks Lord Krishna, why is it that you work? And Lord Krishna actually proactively says that, see, I am God, I do not have to work. Yet I work for two reasons. One, to set an example for other men, so that other people follow my example. And second, to take care of my physical body. So that's why I work. So, sir, suggestions for people with thyroid. Is it fine to say कि मुझे तो thyroid है, therefore I cannot exercise? Therefore, I
No,
shall not exercise, and therefore, I will not exercise.
no, that is wrong. Because once you take levothyroxine, you're pretty much getting back to almost close to normal. I cannot say that people go back 100% to normal, but you're getting back close to normal. एंड वंस दैट हैपेंस, आप एक्सरसाइज कर सकते हैं, आप फिजिकल एक्सरसाइज, दौड़ना भागना सब कुछ नॉर्मल तरीके से चलाते हैं। एंड फ्रैंकली 80-90% ऑफ द केसेस जहाँ पर पीपल टेक लीवोथायरॉक्सिन, और उनका डोज टाइट्रेशन 6 महीने 7 महीने के बीच में पूरा बराबर हो जाता है, तो वो तो बिल्कुल नॉर्मल लाइफ लीड करते हैं। तो ये तो गलत है सोचना कि एक्सरसाइज नहीं करनी चाहिए।
And exercise will actually help build your muscles. So it will keep your weight in control. And जो weight बढ़ता है thyroid में, it is not so much because of thyroid. The weight increase is because of actually an imbalance between intake and output. So if you exercise, if you burn calories, actually you can bring your weight down. Secondly, if you do resistance exercises, then you can maintain and build your muscle mass. तो आपकी muscles weak नहीं होंगी, आपकी bones भी strong रहेंगी, and that will help prevent many other diseases, muscle and bone disease. Sir, now
Yeah,
Dr.
but
Dharmaraj asked,
Dr. Sanjay, the one thing is there that अगर पूरा लिवोथायरॉक्सिन का ट्रीटमेंट पूरा टाइट्रेट नहीं हुआ हो, तो मेटाबॉलिक फैक्टर तो वेट गेन हो जाता है इसमें। तो जब तक पूरा लिवोथायरॉक्सिन नॉर्मल लेवल तक ना आ जाए, TSH नॉर्मल लेवल तक ना आ जाए विथ लिवोथायरॉक्सिन, तब तक मेटाबॉलिज्म वेट गेन हो
होगा.
सकता है। तो
Yeah,
yeah.
that's right. And sir, now Dr. Dharmaraj asked this question. Let's divide it in two and take it one by one. So he says patient is on levothyroxine 100 microgram. How do I change the dose based on symptoms and signs, that is clinical? So we'll ask Basin Saab to answer this. And biochemically. So let me take the biochemical part. It depends upon the etiology of or the reason of hypothyroidism. If the patient has had thyroid cancer and has had a surgery after that, then you want to keep the TSH at almost zero. If the patient is planning pregnancy, a young lady, then you would want to keep the TSH below 2.5. If the patient is pregnant, is antenatal, then depending upon the time, of pregnancy, the gestation, you would want to keep it below 2.5 or below 3. So this is special situations. Now, for all other people, apart from pregnancy and thyroid cancer, you can keep anywhere in the normal range, but the younger the patient, the lower the TSH target. The elder the patient, the elder the person, the more relaxed the TSH target. If you have patients with bone disease or heart disease, you would relax the thyroid target. Even 5, 6, 7 should be fine as long as the patient is okay. So first of all, we've understood about the targets now. Each person will have a different target. And now let's talk about symptoms and signs. Bhasin Saab, as a thyroid expert, what is it that comes most important to you? What are the signs, what are the symptoms which would tell the doctor, let me think of increasing the thyroid dose? And what are the complaints which would tell the doctor, let me think of reducing?
Well, I think that is not what I would advocate because thinking is not
Yeah, it's
thinking
just
doesn't
thinking,
get
and then we are
the
coming to
right
the cases
result.
next. Yeah.
You know,
So we're
you
just
have
thinking, and then we'll come to the thyroid numbers.
yeah. So the first thing will be the complaint from the patient, and you know this is very important. Like very often we feel that doctors don't listen to the patient, and they say we know what we are doing, and you don't worry about it. They take this medication, you'll be fine. No, when the patient is complaining and telling about the symptoms, I think it's important to note down the symptoms. And I think the first thing the doctor should do is recommend a TSH test because the symptoms are there. And when you do the TSH test and the TSH test is out of whack, it is 7, 8, 9, 10. Then I think it is important that you do the dose titration. Then you got to increase the dose and that is what needs to be done and look in this thyroid thing sometimes it could take more than 6 months almost 6 to 1 year before you get the right dose titration for the patient and every 2 3 years they should do the TSH test till they the dosage changes then they have to change the doses. That's why it's so many micrograms 12 strengths are available in this medication.
सो जो सिम्टम्स एंड साइंस हैं उससे हम थिंक करना शुरू करेंगे बट प्लीज डू नॉट चेंज द डोज जस्ट बेस्ड अपॉन सिम्टम्स कि आई थिंक आई एम गेनिंग वेट सो देयरफॉर आई विल इंक्रीज द डोज. अगर आप ऐसा करेंगे यू मे और मे नॉट लूज वेट, दैट इज अ सेपरेट मैटर, बट सर्टनली यू विल एंड अप हार्मिंग योर बोन्स एंड योर हार्ट. एंड ऑल्सो बस मैं ठीक चल रही हूँ तो मेरा दिल है कि मैं दवाई कम कर दूं तो मैं दवाई कम कर दूं, दैट इज ऑल्सो नॉट राइट बिकॉज आप अपनी मेटाबॉलिज्म को हार्म करेंगे. So
Yeah.
ideally we should, yeah, sir.
You raised a very good point, Sanjay, because many times people feel, अरे अब तो हम ठीक हो गए, तो एक डोज स्किप कर देंगे, दो डोज स्किप कर देंगे. इसमें इस चीज में कोई गुंजाइश नहीं है आपको कि स्किप करें डोज. आप नहीं स्किप कर सकते हैं. रोज सुबह उठ के ये लेने का ही है. तो ये बहुत जरूरी. दैट्स अ गुड पॉइंट यू मेंशन.
एंड अगर आपने दवाई कम कर दी, इक्विवेलेंट इज कि मुझे ठीक दिखाई दे रहा है ऐनक के साथ, तो मैं एक चश्मे का एक शीशा उतार दूं. इट्स इक्विवेलेंट टू मी रिमूविंग वन लेंस फ्रॉम माय स्पेक्टिकल्स जस्ट बिकॉज आई थिंक आई कैन सी प्रॉपर्ली. देन आई विल गेट इन ट्रबल. Or if you're driving a car, maybe you're driving at fifth gear, fourth gear, and things are perfect. Why on earth would you want to change the gear if things are fine? So food भी तो है. You eat food, you drink beverages every day, and you feel happy. But that doesn't mean that you're going to fast for the next 1 week. So why should you fast with your levothyroxine tablet? So then we come to the numbers. So this was the question by Dr. Dharmaraj. You've decided the target first. If you're at below target, you will reduce the medicine. If you're above target, you will increase the medicine. If you want a lot of precision, we have these 12.5 microgram tablets. So you can reduce from 50 to 37.5 or from 100 to 88. But
Correct.
if you feel that the TSH is very low or very high, the patient is overweight or obese, maybe 100 kg, 90 kg, you can also increase or reduce by 25 microgram, increments or decrements. So that is usually how we follow and do it every 6 to 12 weeks. Don't do very fast. Don't do it on weekly basis. पंकज शुक्ला जी सर एक क्वेश्चन पूछते हैं डोजेज पर केजी इन अडल्ट्स एंड चिल्ड्रन. सो मिस्टर वसीम रेज्ड एन इम्पोर्टेंट पॉइंट अबाउट कंजेनिटल हाइपोथायराइड. तो सर जो
Yes.
कंजेनिटल हाइपोथायराइड है इनका तो होता ही नहीं है थायराइड ग्लैंड. सो दैट मींस दे
No.
वुड नीड अ हायर डोज पर केजी.
Actually,
एंड
that is
हैव
not
यू
true. It's not. It's not that there is no thyroid gland. 80 to 85% cases of congenital hypothyroidism, there will be no thyroid gland. But another 15%, there may be a thyroid gland, but it is not functioning.
Not
So
working.
that is sometimes misleading. So both the cases are there. Sorry about that.
Yeah. And you would need a higher dose per kg, even 5 to 7 microgram per kg per day in a neonate. But as age increases, you need a lesser dose per kg body weight. And sir, we have with us also Vinny Joglekarji. She is a nutritionist based in Bangalore. So she asks, you have such vast international experience. Have you encountered any myths about nutrition in thyroid?
This is a very good question because it is myths. Okay, it is really myths because there is no proper food or there is no specific food for to be taken or not to be taken with thyroid condition. The only thing some people say fatty stuff should be cut down, but I don't know if there is evidence towards that. The whole thing is you have to make sure that you take your drug 2 hours before taking anything, water or anything else. This is the thing. And you also mentioned one more thing, Dr. Sanjay, about fasting. A lot of people fast in India. You might be fasting, but don't stop your levothyroxine. You cannot stop that, because that's giving you energy every day. So you cannot stop that.
So even if you are observing the holy month of Ramzan, you take the medicine at least 30 to 60 to 90 minutes, जितना भी possible है, before suhoor. मान लो भूल गए. Let us say you forgot to take the medicine before suhoor because you were in a hurry. You had to prepare food for the family and you just forgot, let's say. The sun came up first. Then you can take it the same day just before going to bed. आखिरी चीज जो करेंगे before going to bed वो कर लें. So don't skip the medicine. दिन में आपको फास्ट करना है, रमजान नहीं तोड़नी, तो रात को ले लें गोली. So try not to change the time, but in case you've forgotten, you can always take it 12 hours later or 18 hours later. Sir, there's another question. Would you like to take it or should I? This is from Dr. Ram Babu. Why do we treat hypothyroidism based on TSH levels rather than T3, T4 levels?
Well, that's a good question. And T3, T4 levels are important. But see, T3 is produced from all the cells in the body. Okay, so it's a bit more complicated when you start combining T3 and T4. But in some cases, in very very few percentage of cases, it does seem to benefit the patient, and the patient feels okay. It could be placebo effect also. We don't know, but in medicine, placebo effects are so important, and they play a very important role. People feel better, so that could happen, but T4 is more important. T4 levels are more important, and T4 levels should be as close to 1 as possible. Because a lot of people think, oh, it's 10, we don't need to treat. I don't think that is right. 10 can cause problems. And if there are symptoms with 10 or 7, 8, whatever the reading, then you have to take care of the symptoms. And once you put a person on levothyroxine, and with titration, it can reach a level of 1, 2, 3. That's pretty good.
The What happens, Dr. Pratipati, is that TSH rises first. So when the thyroid gland becomes a bit weak, this is in Hashimoto's thyroiditis, which is around 90-95% of all the thyroid patients that we would see in India. So जो T3, T4 हैं, they are produced by the thyroid. They begin to fall in an arithmetic manner. It is arithmetic progression. But TSH जो है, that rises in a logarithmic progression. It rises very fast. And you get to know the change in TSH much, much before you get to know the change in T3, T4. So इसलिए we treat it because it is a much more sensitive marker. You can treat with tablet T3, you can treat with tablet T4, but like Basin Saab said, most of the time T4 will suffice. Yeah, you wanted to add something?
You talked about Hashimoto's, and I wanted to just touch upon Hashimoto's. In Hashimoto's, you find thyroid peroxidase, that is TPO, and these
Yeah.
are rogue immune cells which attack the body. So Hashimoto's is very very small amount of people, but it becomes sometimes very difficult to diagnose that. But Hashimoto's has to be diagnosed properly, and these are the rogue cells, immune cells which act as they are normal, but they attack the system. and they cause problems. So that's really different from hypothyroidism symptoms. It's similar, but it's more severe.
So, in countries across the world, there are different causes of thyroid. In India, 30 to 40 years ago, the commonest cause was iodine deficiency. Today, the commonest cause is autoimmune, and actually, in our country, data from across the country shows that around 20% of all Indian women are antibody positive. 20%. This is a very high rate. Why has this occurred? This may have occurred as a response to iodization of the previous generation, because a similar situation was seen in Austria and in Switzerland about 100 years ago. ऑस्ट्रिया और स्विट्जरलैंड में भी पहले आयोडीन डिफिशियंसी होती थी, और जो जर्मनी वाले फ्रांस वाले लोग थे जो प्लेन्स में रहते थे, वो ऑस्ट्रिया स्विट्जरलैंड वालों को हिली बिली कहते थे. हिली बिली, दैट्स द बॉयज लिविंग इन द हिल्स, कि इनका आईक्यू कम है. तो इट माइट हैव बीन बिकॉज ऑफ आयोडीन डिफिशियंसी, वी डू नॉट नो. सिमिलरली, जब आप 800 या 900 साल पुरानी राइटिंग्स पढ़ते हैं अरब स्कॉलर्स की, अरब्स मगरेब से होते हुए स्पेन की तरफ गए, एंडालुसिया की तरफ, और उन्होंने जो डिस्क्राइब किया यूरोपियंस को कि वो बिल्कुल ही लो आईक्यू के हैं, लो आईक्यू के हैं. एंड बट सडनली क्या हुआ, 100 150 सालों में यूरोपियंस ने अरब्स को बाहर निकाल के फेंका, एंड दे बिगैन रूलिंग द वर्ल्ड. Why did that happen? There is one theory. Of course, it is a hypothesis published in Indian Journal of Endocrinology Metabolism. And what we feel is कि ये जो ट्रेड स्टार्ट हुई अरब वर्ल्ड के साथ, सहारा डेजर्ट में सॉल्ट माइन होता था. So maybe the Europeans were short of salt. Because they were short of salt, this is 900 years ago, they were short of iodine as well. And when they began getting salt from the Sahara Desert, this salt contained natural iodine. Then suddenly things changed and their mental and physical health improved. That is a hypothesis. Of course, many other things would be linked with that. Coming back to India, हमारे यहाँ जो कॉमनेस्ट कॉज है दैट इज एक्चुअली ऑटोइम्यून, जिसका इंग्लिश में नाम है हाशिमोटोस थायराइडाइटिस. मेन और विमेन दोनों में है. मेन में तो इतना बढ़ गया, 20 साल पहले हमें कोई पेशेंट दिखता ही नहीं था, एंड नाउ इट इज क्वाइट फ्रीक्वेंट. एंड लाइक आई सेड, इन आवर ओपीडी एंड अक्रॉस द कंट्री 20% आर एंटीबॉडी पॉजिटिव. इसके अलावा और भी रीजंस हैं, एंड दैट इज वन इज कंजेनिटल, जिसमें इंडिया के आंकड़े हैं रफली 1 in 2500 बर्थ्स. तो अगर आप 2500 बच्चों का थायराइड चेक करेंगे, एक को कंजेनिटल हाइपोथायराइड निकलेगा, विच इज क्वाइट हाई एक्चुअली, एंड वी नीड टू वर्क ऑन दैट. सर, एक और क्वेश्चन आता है. दिस इज फ्रॉम दिव्या छाबड़ा आहूजा जी, एंड व्हाट शी सेज इज, you've talked about congenital hypothyroid, so every newborn baby in India, in the world, must be screened for thyroid.
Yes.
Would there be any argument in this statement?
No, there is no argument. Look, children are precious, okay, and they are sort of a gift. And when we get that precious gift, I think it is upon us and the health authorities and the government to mandate it, like in Canada and US, I think, and many other countries. When the child is born, you do the TSH test. And quite often, I have seen children in India, in my family side, born, almost 50, 60% of the children get a little jaundice when they have, but that's nothing. It goes away after some time. But some children, that jaundice doesn't go away, and that is a time of concern. And they sleep a lot. So that is,
Yeah.
I think it should be mandatory, and I think that is the right thing to do. That every child should be screened for thyroid condition.
Every child must be screened, and खासकर अगर आता है जी, in Punjabi, the दादी or the grandmother says, बड़ा ही बीबा बच्चा है, मानू बिल्कुल तंग नहीं करता, दूध ही नहीं मांगता. So the child is so quiet, so sleepy, the child doesn't even ask for milk. The neonate, the newborn baby, that it doesn't mean that the baby is well behaved. It means that the baby is unwell. Why is the baby not thirsty for milk? So you get a thyroid done. And
And
then
and
Divya ji,
one more thing, Sanjay, this is interesting, and I go back to the days in the school. Some people you just couldn't understand something, just couldn't comprehend something. And
yeah,
I think they had the thyroid problem, you know, and that was a lack of concentration that they had. So sorry to bulge in that, but I'm reminded of that.
Uh, and Divya ji asks, should we, continuing with your thought process, should we get thyroid test done for children aged 5 to 10 years? Is that
Not
mandatory in the Canadian school system?
No, there is no mandate for that. It depends on the symptoms. If somebody has symptoms after that, after the initial screening and all that is done when they are born, and they have that, then you will do that, not without that, because frankly, in young people you don't see much hypothyroid uh, issues. But thyroid cancer, for example, can get into a very young person. Hashimoto's can get into young person. Also, Graves' disease can get into young people, but not normally hypothyroid condition.
Though, if there is a family history of thyroid in the mother, usually we do tell our children around the time of puberty. There's no harm in getting a TSH done. जब भी यार लड़की आती है रुबेला वैक्सीन के लिए तो एक TSH करवा लें. बट ये लिमिटेड होता है to those with a family history of thyroid. And जो पैदाइश के टाइम पे थायराइड करना है, that is mandatory for everybody. In India, sir, we also have mandatory thyroid testing for every pregnant woman in the first trimester. And
Yes.
we encourage it in the preconception before they are planning pregnancy. So, what is your take on that, sir?
But that is very important because, and that's where gynecologists are also involved in this. That once you are pregnant or you're going on to get pregnant, a lot of people do not get pregnant because their thyroid condition is not normal, and they have hypothyroid condition. They just cannot get pregnant. Both it is husband and wife. So you should, when you don't get pregnancy and conception, you make sure that both husband and wife are checked for that, because that is a problem. So I think it is very important that it should be mandatory to check their thyroid level, because that is going to be playing a very crucial role in the development of the child in the womb. So that is very important. It should be done.
And it's for two generations actually. Sir, in Indian philosophy, we have the concept of karma, karam, which is a Sanskrit, a Hindi word. Karam can be past tense, present tense, and future tense. Whatever we did in the past, that influences our health today. That is health karam. And whatever health related behaviors we'll follow today, that influences our health tomorrow. You don't have to wait until the next existence. मगर थायराइड और प्रेगनेंसी की क्या ब्यूटी है, देयर इज अ कॉन्सेप्ट ऑफ ट्रांस जनरेशनल कर्म. तो जो भी कर्म मदर करती है ड्यूरिंग प्रेगनेंसी, वो उनके कल को तो इन्फ्लुएंस करते ही हैं माँ के कर्मों को. So, like, let's say she takes care of herself during pregnancy, she will be healthy after delivery as well. She'll be able to feed the baby properly, she'll be able to work in a healthy manner. मगर उसके अलावा वो बच्चे के कर्मों पे भी impact डालती है. So, whatever karma she follows during pregnancy, that will influence the health of the next generation. If she doesn't take her thyroid medication, if she doesn't take her iron, calcium, she doesn't look after herself, doesn't look after her BP, the child will also get in trouble later on. So, this concept of transgenerational karma is very important, and like the Abhimanyu syndrome, we call it from the Mahabharata, that is something that plays out in the thyroid, in the scenario of pregnancy, considering thyroid. Coming to calcium and vitamin D, Poonam madam पूछती हैं कि why are calcium and vitamin D supplements given to all people with thyroid?
Well, because there has been an erosion of that before, when the person was not treated. And I think to get the levels back, that could play an important role. I can't think of anything else.
And in India, vitamin D deficiency is very common. We are blessed with sunlight, but we are a heliophobic nation. हम धूप से डरते हैं. And जैसे जैसे आपका socio-economic status बढ़ता है, as your socio-economic status improves, your nutrition is supposed to improve. But there are two exceptions. One is vitamin B12, and the other one is vitamin D. So vitamin D is easy to understand because the richer you become, the less you go out into the sun. You wear more clothes, you remain in the AC, you use sunscreen. So all these things take place. For vitamin B12, the theory is very interesting. पहले हम कुएं का पानी पीते थे या नदी का या तालाब का, which used to have lots and lots of bacteria. Now vitamin B12 comes only from the animal kingdom, not from the plant kingdom. तो जो पहले हम पानी पीते थे वो इतना polluted था, उसमें इतने सारे बैक्टीरिया थे, हमारा B12 पूरा हो जाता था. But now we drink clean water. We have access to safe drinking water in India and in most parts of the world. तो B12 हमारा खत्म हो गया वहां से. And our diet is predominantly vegetarian and vegan. And that's why we don't have any B12 source left in the diet. That's one of the theories for B12 deficiency in India.
So, Sanjay, you raise a good point, and I want to tell you something about structured water. What is structured water? Structured water is the water that falls, comes from the mountains, goes through stones and goes through the earth and filtration. And sometimes it is what water we drink is after, like kuएं ka pani, for example, is after hundreds of years of filtration and all that we get. So we get total structured water. Water has a structure. And you know what is happening with the municipalities and clean water? We are trying to kill the bacteria and all the other sources which could be bad for us. But in the process, we destroy the structure of the water. So a lot of these waters which you find in bottled water and all that is no good, because structured water is the one. Our body is made 80-90% of water. Imagine. So, having structured water is very important. Now, this is the concept which is slowly catching up in the world. But for thousands of years, we relied upon structured water. And now, suddenly, with all these municipality water filtration plants and all that, which destroy the structure, we are not getting the proper structured water. Can you imagine?
जिस तरह से हम बात करते हैं मैक्रो न्यूट्रिएंट्स एंड माइक्रो न्यूट्रिएंट्स की, we should be talking about, though we don't, and thanks to Basim Saab for raising this, we should be talking about mega nutrients. And one mega nutrient in our life is water. It is a nutrient. Without that, you just can't live. Another mega nutrient might be fiber. And I think these are the things that are least talked about. So thanks to Ashok sir for raising these points and telling us that we should view water with with the respect that it deserves. Na kam na zyada, not too much, not too little. Just जो पानी की अहमियत है, उतनी ही उसको दें, उतनी ही इज्जत दें. And we have a question, sir, from Calcutta. Seema ji hain, an advocate for patient health. She says, can we structure water in clay pots and copper vessels?
Yes, but structure water is a long process. And another way to do structure the water is vortex. So when you create a vortex, it can structure the water. But the clay sounds to be good. Again, it's not being filtered in the clay, but keeping it there, I'm not sure of that. But it has to have the whole filtration process till it gets structured. So that has to be there.
So, good question, Seema ji, and let's find out more about this. Adab to Nahida Taranun ji, who has joined us, and she says, good evening to you. Uh, Let me take this question from Moni Zuchi ji, who says, what is the best source of vitamin B12 for vegetarians? So the answer would be dairy foods, actually, paneer, cottage cheese, curd, but it's not all that rich. The second best source would be colored fruits, colored vegetables, maybe spinach, uh, oranges, but overall, they are not very good sources. Uh, Dry fruits, which we encourage, are very good for health. They have lots of essential fatty acids, but they are not a good source of B12. Another question that Moniji asks is, does thyroid pass from mother to newborn? Yes, it can, and often it does. But it is not that the newborn will get it immediately. It might manifest later, during puberty, during pregnancy, any time in life. एंटीबॉडीज अगर पॉजिटिव हो मदर में, तो 50% चांस है कि बच्चे में भी एंटीबॉडीज पॉजिटिव होंगे. यदि बच्चे में एंटीबॉडीज पॉजिटिव हैं, तो 20% के आसपास चांस है कि वो क्लिनिकली हाइपोथायराइड होगी वो बिटिया सम टाइम इन लाइफ. Sir, one
Um,
question for you. Yes, yeah, carry on, sir.
Yeah, I would like to comment on that,
Yeah.
Sanjay. Sanjay, the what we have seen, and this year our topic is going to be thyroid and genetics. So that is a
Mhm.
topic for International Thyroid Awareness Week. So when it comes to Hashimoto's, genetic transfer is very known, like 90-95% case, it will be there, you know. But when it comes to hypothyroid condition, it does not qualify that it will transfer to. I'm not contradicting what you said, but I'm telling in hypothyroid cases, because you're mentioning in other cases, but in hypothyroid cases, that is not necessary that it may happen. और जो और एक और चीज़ है जो हम लोग के सिस्टम है इंडिया में, जहाँ पर फैमिलीज़ को मिलाया जाता है और जो उसकी राशि देखी जाती है और ये सब देखा जाता है। एक्चुअली वो क्या कर रहे हैं, वो ये सब देखते हैं हेल्थ ट्री दोनों फैमिली का, और वो मैच होता है। तो ये बहुत अच्छा सिस्टम है, जो मैचिंग करते हैं, उसमें उन लोग को सब पता रहता है क्या डिज़ीज़ है, क्या नहीं है, ये सब without really mentioning all that. So ये दो अच्छे जोड़े बन जाते हैं, हेल्थी चिल्ड्रन पैदा होते हैं। यहाँ पर हम लोग क्या देखते हैं, ये जब fall in love or you don't look at all the things, then the genes are getting weaker and weaker after two people with bad genes get together. So that is something that the system in India, where everything is mashed before the marriage, it is something to applaud.
And this is especially important for thalassemia, which is a major public health problem for us. यदि लड़का और लड़की दोनों thalassemia trait हैं, thalassemia minor है, it would be a good idea not to get married because there is a chance of the baby, चाहे 25% ही हो, of the baby developing thalassemia major, which is a life-threatening issue. Sir, we have so many questions and it's already 7:45 p.m. here in India. But एक question जरूर लेना चाहूंगा और ये कैलकाटा से है. Sir, Indian women are emotionally weak. Now that is a big question mark. Are they resilient or are they weak? चलो सवाल ये है, Indian women are emotionally weak and subjected to emotional अत्याचार. Okay. How is emotional state of a woman related to her thyroid disease? ये सवाल है सर आपके लिए.
Well, first, I would like to respond. Indian women are not emotionally weak. We have had Indira Gandhi as the prime minister, and look at Calcutta and Bengal. This woman is leading there. So, Indian women are not weak. I would disagree with that. They are strong, and they're pretty strong, and they play a very important role. And, you look traditionally also, historical culture, Devis and Ranis, and, those rulers have been there. I mean, that you don't see in the West so much as you've seen in India historically. So, but emotionally, yes, we are all emotional beings, and women are more emotional than men, and that emotions can play a role. But emotions can only play a role when it comes to thinking, when it comes to thought process, and when it comes to uh, the emotional part or the mental part of it, but not physical part of it. And they are very strong. I mean, they have been in India still. A lot of them are working in the fields and doing a lot of hard work, much harder work than men. So they are strong. They are a strong group.
एंड देन अनदर क्वेश्चन अंशु सिंह जी का जो था, व्हाट इज नॉर्मल टीएसएच विदाउट मेडिसिन. तो एक हमें टारगेट चाहिए होता है विच वी ऑलरेडी डिस्कस्ड. थायराइड कैंसर हो तो अलग, प्रेगनेंसी प्लान करें तो अलग, एज, बोन डिजीज, हार्ट डिजीज के हिसाब से अलग अलग. सो द थ्रेशोल्ड्स वी द टारगेट्स वी ऑलरेडी डिस्कस्ड, एंड वेदर यू अचीव दोस टारगेट्स विद मेडिसिन और विदाउट मेडिसिन, द टारगेट विल रिमेन द सेम. So if you're not at target, we need to take the medicine. And Dr. Pawar sir, अगर 120 या probably 125 माइक्रोग्राम थायरोनॉम चल रहा है, लेवोथायरॉक्सिन चल रहा है, if the TSH is fine, we'll continue the same. Sir, another question is from Ruchi ji. Does thyroid cause nerve damage in the body?
I have not come across that at all. But one thing is definitely there. If you don't manage your thyroid TSH levels, it can affect a lot of things. It can affect your bones, it can affect your heart, it can affect your metabolism, it can affect, the passing of the whole gastric system. It can affect your brain. So there are a lot of things that can affect. But one of the things I wanted to also touch upon, and I'm forgetting that because I was just thinking when you were talking that that's very important to mention, and that is many people at the pharmacy level, they do not take the same medication, whichever company it was. And this is only in case of levothyroxine. I'm telling you, it is a very narrow therapeutic index product. That's why if you have been, say, Sun Pharma has this product, and if you have been prescribed with Sun Pharma levothyroxine, you should remain only on Sun Pharma. You should not change it. And again, if it is from Abbott, you should remain on Abbott. Or if it is from other company, you should remain on other company. Why? Because every product has different bioavailability, and the percentage of levothyroxine 5, 10, 6% low, it is in that medication manufactured by that company. You cannot change that. If you change it, you can go back to zero again. So I think it's very important that doctors make sure that when the prescription is filled for levothyroxine, bring back that medication and show it to me because it should not be changed by the pharmacist, and you
Yeah.
have to say, do not change it. You know, so that should not be substituted. Otherwise, people can go back to zero. Sorry for bringing this up, but I think
It's important actually. Don't change your thyroid medication, and whatever dose titration is done, do it. The symptoms are important, and like Helen Jayadevi points out, altered menstrual cycle, hair loss. These are also symptoms of
yes,
hypothyroid. But
yes,
read the symptoms along with the report, and then change the dose. Keep the company the same. A few questions, sir, if you allow. Let me take in a rapid fire kind of a mode. TSH test to be conducted empty stomach, ideally maybe yes, but not necessarily. In the morning would be a good idea. If you're doing TSH, there is a change morning, evening, night, but it is usually clinically not significant. And if Moniji, if there is iron deficiency, then the treatment is iron. Good idea to take the iron capsule at night, not in the morning, because it will reduce the absorption of your levothyroxine 88,
correct.
which seems to be a fine dose. There is a nano iron as well, liposomal iron. And if you feel that you have GI stomach side effects because of the normal iron preparation, you can try liposomal or nano iron. Again at night, the stool will not turn black, you will not have any stomach upset, and it will not impact the thyroid medicine absorption. So speak with your doctor about that. Bone density, yes, Dr. Vipin. Actually, uncontrolled thyroid, both hyper and hypo, do impact bone density. But if we keep the patient euthyroid, then we are fine. And Divyaji, if depends upon the reason. If the patient has got autoimmune disease or congenital hypothyroid, these are the commonest in India. Then the thyroid medication will continue lifetime. We are talking about hypothyroid. If it is Graves' disease, hyperthyroid, usually our medicine lasts 1.5 to 2 years. It might be less, it might be more. And Poonamji has a best practice. She says a glass of water, a small glass, should be kept by the bedside along with the thyroid medicine. You can take it, you can wake up around 4 a.m. or so, 6 a.m., take your medicine, go back to sleep, and then you wake up and begin your routine. The thyroid medicine gets absorbed. And what you believe, Poonamji, is right. Thanks for sharing it. This is the best way to consume the thyroid medicine.
That's
Namaskar to you,
correct.
sir. Yeah.
And
From
then
Awadh
in our
Kishore
age,
Rathwar. Yeah.
we get up in the morning at that time anyway, so it's good.
And namaskar to you, sir, from Awadh Kishore Rathwar ji. And greetings from Dr. N.S. Sharda. Dr. Sharda, sir, is one of our senior most, he has the maximum experience of youth, Basin Saab. He's from Ahmedabad, and blessings from him to you, sir.
Oh, thank you.
Dr. Vipin shares a case where he was able to manage a hypothyroid lady with a TSH of 11.9 with 50 microgram, and the TSH has come down to 2.4. So we will continue the same dose. We will not
Yeah.
change. And actually, dose does is linked not to the TSH number. The dose is linked to the weight. So what the books tell us is 1.6 microgram per kg per day for an average adult. But it doesn't work out that way all the time. Most of the time, we need a much lower dose in India. But the average would be 1.6
You know, one thing I want to say, you don't treat the readings, you treat patients. So
patient. That's
always
true.
remember that.
Hmm. And in India, usually a lower dose will suffice. Usually, if you need too much of a dose, before increasing the dose, think about what is going wrong. Maybe patient थायराइड की दवाई के साथ मेथी का पानी ले रहे हैं, धनिए का पानी, जीरे का पानी, फेनुग्रीक वाटर, कोरिएंडर वाटर, any kind of high fiber diet which is preventing absorption. मे बी पेशेंट थायराइड की गोली गलत समय पे ले रहे हैं, एट द रॉन्ग टाइम ऑफ डे. मे बी थायराइड की दवाई आयरन या कैल्शियम के साथ ली जा रही है, सो इट्स प्रिवेंटिंग एब्जॉर्प्शन. एंटासिड के साथ, विद एंटासिड. So these are the things to rule out before you jump to increasing the dose. And yeah, carry on,
You
sir.
know, it is very good point because many times people are taking a lot of OTC medication and supplement, and they say, no, we're not taking any medication. But
Mm,
those are like medication. Those are medications actually, and they interfere with this. So you made a very good point.
yeah. And then there are times when the vitamins that we are taking, you are taking an OTC, a multivitamin, it is not impacting the absorption of the thyroid hormone, but it impacts the way we test for thyroid hormone. So जब हम TSH करते हैं टेस्ट, उसमें भी तो chemicals होते हैं. So some of these vitamin Bs, they go and impact the methodology of testing. That is why the report comes wrong. So समटाइम्स इट वुड बी अ गुड आइडिया टू टेल योर पेशेंट्स कि आप सारे विटामिन 5 दिन पहले बंद कर दें, उसके बाद आप टीएसएच चेक कराएं. And in North India, we have a disease called celiac disease, गेहूं की allergy. This is increasing in prevalence actually quite rapidly over the past 2 to 3 decades. We are able to pick up also much better, much more effectively than before. तो अगर सब कुछ आपने टेस्ट करा लिया, थायराइड तो भी ठीक नहीं हो रहा आपका, ask your doctor, ask your doctor if you need a TTG, that's the name of the test, या गेहूं की एलर्जी का टेस्ट चाहिए कि नहीं for celiac disease. Sir, lots and lots of questions, but sticking to one brand, thank you from Seema ji for sharing that point. Adverse effects, Dr. Smita Shah, usually bone and heart if you overtreat. So that is why we keep on doing TSH regularly. And Sapna Jain ji कहती हैं, sir, to add to the discussion, Indian women are balanced. They are balanced with the emotions and resilience. And I'm sure Seema ji will agree with you. So Indian women hold up not half the sky, but more than half the sky. That I would admit. I would be the first to admit.
And also 20% of the gold of the world.
20% of the gold of the world is taken care of by Indian women. Okay, that is a good thing to know. Dr. R.S. Chaudhary, sir, who is a senior surgeon from Haryana, he says thank you. एंड सीमा जी आपको थैंक यू कर रही हैं सर. शी सेज आपने मुझे बायोलॉजी टीचर से डॉक्टर बना दिया. Okay, Zuchi ji कहते हैं, and so this Indian question, let me take it. Sometimes we don't find the same dose in the same brand. That's true. So you, let's say a particular brand you have 75 and 100, but your doctor says 88 low. So you can take 6 tablets in a week. You can count the weekly dose, and you might wish to take 6 tablets or 5 tablets in a week, even 8 tablets or 9 tablets, so that you can get the exact dose. And then we continue with that for a few weeks and then test again.
Well,
It's
you know what, Sanjay, I would say don't prescribe those products which do not have the full strength. Very
okay.
simple. Why do you
Hmm.
want to create problem for the patient?
Hmm. So, but in case that is going on, that's another option you can do. So there's a thank you from Moni Zuchiji and also from Dr. Yogesh Uplechwar, who is just logged in. And before we conclude, sir, it's 1 hour now. Any take-home messages for all of us
You know,
on?
take home message is one. We, doctors and patients, they're not different people because a doctor can also be a patient. Very often, the doctor is not a patient, and sometimes they do not understand or appreciate where the patient is coming from. I think it is very important that we have a communication. And if you want a patient to communicate certain way, you have to make sure to tell the patient next time when you come, I want these questions to be answered. Okay. And tell me these things about the history, what you eat, what supplements you take, and what time you would take, etc. etc. Because you know they are not different. Our patients can be our mother, our sister, our brothers. We are all the same people. Do not treat them any different than what you will treat yourself or how you would like to be treated yourself. I think there has to be a teamwork between patients and the doctors. And if that teamwork is there, this world will be a beautiful place.
The world will be a beautiful place, and I think that's a beautiful note upon which to conclude this talk. And Zuchiji, certainly we'll take not one but more than one sessions on living with thyroid. थैंक यू सीमा जी फॉर योर काइंड कमेंट्स. आपकी आंखें बहुत सुंदर हैं, इसलिए आपको दुनिया बहुत सुंदर दिखाई देती है. एंड सेम फॉर वसीम साहब. द वर्ल्ड इज अ ब्यूटीफुल प्लेस क्योंकि वसीम सर की आंखें ब्यूटीफुल हैं. Pratik is with us backstage. Pratik, certificate of appreciation for Ashok Basin, sir, please.
Oh, thank you. Oh, that's wonderful.
Thank
Thank
you.
you
It's
very
been great
much.
having you. We'd like to thank you, and we'd also like to thank Thyroid Federation International for all the good work that it's doing for improving thyroid health across the world. इससे आप सब इसके साथ आप सबसे इजाजत लेंगे. KK Med Talks is on air daily 7 to 8 p.m. Indian Standard Time, और मैं आपके साथ होता हूँ हर सोमवार और हर वीरवार. इस वीरवार हमारा टॉपिक होगा पीडियाट्रिक सर्जरी पे, एंड डॉक्टर अरविंदर सिंगल हैं पीडियाट्रिक सर्जन फ्रॉम न्यू बॉम्बे. ही विल बी स्पीकिंग टू अस. मगर हमारी कोशिश होती है यही चीज, जस्ट टू स्प्रेड अवेयरनेस, स्प्रेड नॉलेज, एंड इन वसीम साहब्स वर्ड्स, टू मेक द वर्ल्ड अ मोर ब्यूटीफुल प्लेस, अ हैप्पियर एंड अ हेल्थियर प्लेस. इसके साथ फिर से इजाजत मांगेंगे आपसे. धन्यवाद, शुक्रिया, मेहरबानी,
Namaskar.
शब खैर एंड जय हिंद।
Thank you.